welcome today. We're excited to visit with Addison Collingsworth with Simply Smart Homes to talk a little bit about the combination of technology and home care support and home care management, and how we can together help seniors age safely at home to give families more peace of mind and also improve healthcare outcomes by being preventative in healthcare and reducing hospital readmissions. So Addison, thank you so much for being with us today. If you could share a little bit about your story, how you got into what you're doing, and just how valuable it is to families and the peace of mind that you're bringing.
Yeah, so I started about 2.5, 3 years ago, officially two, when I had an issue with my grandparents that came up, where my parents came to me and they were telling me about the fall risk my grandma was having at the time, and this bad tendency my grandpa had for leaving his truck running in the garage when he would come home from golfing, and they live off a golf course, or they did at the time. And they were worried that, well, there'd be gas buildup that could be really dangerous in the house, and they were worried about a couple problem spots where my grandma could potentially fall and hurt herself. So they were just talking to me about it, and at the time I had started looking into home automation and smart tech like that for a personal hobby, just trying it around my house, putting stuff in, and that kind of got the wheels in my head turning. And I decided, hey, maybe I could use this stuff to help my grandparents stay in their house a little longer and not have to worry and look towards solutions like a full-time senior living facility or something like that. Maybe give them a little bit more independence. So I started looking at specific devices and how they integrated with each other, and came up with some solutions that worked really well for exactly what my grandparents were looking for. So for example, I found a smoke detector, CO2 detector that I was able to put in the garage that I linked to the smart garage doors I set up. So if my grandpa left his truck running, he could have the garage door automatically open. It could set off an alarm inside. It could make sure the doors were unlocked if they needed to get out of the house. And then it would call myself or my parents, or if we needed, if no one answered after that, 911, to make sure someone got over there and someone was aware of what was going on. I was able to set up some smart speakers and with microphones in them around the house at different spots in case my grandma fell and she didn't have her phone on her. So at any time she could just call out for Alexa, and it would just put her through to us, or it would call 911 if she needed, so she could get help that way. And then some other features, just if they were a little forgetful, making sure that the doors would lock every night at a certain time, that we knew if the windows or doors were left open for too long or for multiple days in a row, and things like that. And that kind of expanded into a full-time business where I'm helping people in their houses set up some of this home automation for entertainment, for security, for utility savings, but also helping seniors and different people with specific either disabilities or needs in their houses replace some of that functionality or add it back to their house in ways that are tailored specifically to them and work the best for their environment or situation. But yeah, it's kind of a unique job where it adds, there's a little different aspect to each job I do when it depends on specific customers and what their needs or wants are. But usually it just starts as a conversation of what they want to accomplish in their house or what they're struggling with. And then we kind of go from there and just shoot for the sky. Really, I always tell everyone, if there's a sensor, if there's a motor, if there's something on a practical device like a doorknob or a light bulb or something, we can make it do whatever you want. Whether that's turning your porch lights on, depending on if it's nighttime so you can see better, whether that's maybe putting a sensor on a drawer so you know if it's opened or not, in the case of if your say parents or something need help reminders to take their pills, or if you want to make sure they get out of bed at a certain time each morning, if there's problem spots in the house where you're afraid that they might fall and be hurt or something like that. But yeah, it can be tailored specifically to exactly what individuals want and need at the time. And then we just set up a system that works exactly how you want it. And as part of it too, we try to give as much value to customers and people and their families as we can by making sure that we minimize monthly costs, try to keep everything up front as a whole package you buy at one time, not monetizing it or having long-term leasing fees or contracts or anything like that. and then give you the tools to be able to add stuff in the future or change things, because we know situations change and they can there's a need to facilitate moving, or maybe adding further care, professional care further down the line. And we want to help with that as well and make sure that transition is smooth. So yeah, tailoring it to what our customers and what our families and their adult children are looking for them, and making sure that the system does what they need.
So Addison, I like that point about just like doors locking at a certain time.
Yeah.
So Karla and I have done some podcasts about a balancer, and a balancer is a person that's managing, caring for multi-generations, their own kids, maybe grandkids, and their parents. And I think about when I used to travel a lot in my career, one of the things that I would do, I'm sitting in my hotel room and thinking about my family. I'd go and turn the alarm on because I know nobody else in the house would do that when I'm not around.
Exactly.
Then you've got like that peace of mind. You're like, okay, I sleep better at night because I know things are taken care of. So I think of a person that's like a balancer, that's always thinking about how their parents are doing. To be able to look at some of those things could be pretty valuable for that peace of mind.
Yeah, well, you don't have to be older to forget to lock your doors or your garage, shut your garage doors. I have one of the things that started me on this hobby was just the fact that I always left the garage doors open, and that was a constant problem for me. So I was like, I need my phone to tell me if it's been more than 10 minutes and my garage is still open. I just need it, otherwise I will forget. So I just set that up. That was one of the first things I tinkered with, and now I just don't forget to close the garage door anymore. It's just not something I have to worry about. So yeah, that having that reminder or that peace of mind to check in with people like that is really, really helpful.
A big part of what I love about our partnership is when you think about the independence that you're giving to people or allowing them to maintain their independence. We see a lot in our industry, more and more of some limitations with cognitive impairment, whether that be just starting stages of dementia, whatever phase that might be. And also when we think about some sensory limitations, vision has been a big one too, when people start to lose their vision, and how some of this, like you said, really keeps people independent as long as possible in the environment that they are so familiar with. We've, served families that, even though this gentleman was legally blind, he knew exactly how many steps it was to get to his bathroom. He knew exactly where everything was in his kitchen. And there was some technology implemented to provide more peace of mind and provide that family peace of mind. But that home environment was something he was so familiar with, and just needed those extra elements of security. I know, Addison, you've got some personal experience with some of these. What sort of tips would you tell people that would just be some of the things you've tried in the past that have worked for clients or for family members that will keep them independent, in combination with maybe some home care support?
Yeah, so the big thing with me, you kind of, or we touched on earlier, memory care, or maybe forgetting specific things. So one thing I start with when we do a consultation to talk to families and about their parents or whoever that need help is what's their daily routine look like, and what are the specific things in their daily routine that either a healthcare provider with them or even them as the adult children are looking to make sure they do. So whether that's taking pills at a specific time, seeing if they woke up in the morning at regular intervals, seeing if they left a door or window open, or making sure that someone's checking in at certain hours. So we start from that basis and then work back on how we can solve those with specific devices. So I know I mentioned just a little bit like a contact sensor in a drawer, so that's where the pills reside. And then if they're not open by 10 a.m. on every weekday or every day they're supposed to take the pills, then a family member or whoever would get an alert immediately saying, hey, it's 10:30. The pills were supposed to be taken half an hour ago. The drawer hasn't been touched. Maybe you should check in. And that can extend to not just memory impairment, but that can also be physical disabilities. So whether that's making sure that hallways or specific trouble areas of the house are always lit up when the person's around with motion sensors and triggered lighting, and pathway lighting too with stairs and dark areas otherwise, whether that's hearing, so creating visual elements to audio stimulus. For example, if you have a smart doorbell, one thing I found that helps with people that have hearing problems is having smart lights that are color activated, so that they can actually turn on and off based on if the doorbell's ringing. So if the person can't hear it, or even the phone ringing too, can be a good use case, the lights will blink red. So if I were in my office right now and I had a smart light bulb back here, and actually have to set up sometimes when I'm working from home, if the door opens and I've got my headphones on and I'm not paying attention, I can't hear, the light below my desk here and overhead will blink. It'll blink blue. And I'll be like, oh, hey, someone's around there. So I'm not always like, oh, someone walk up and scare me over my shoulder because I'm in the zone, you know? So that type of thing, where it gives visual stimulus to things that are happening around them that they can't see. And the inverse is true too with sight. So if there's something that needs to be triggered or you want them alerted to that they can't see, having a audio reminder. So for a door or window opening, have it chime saying, oh, the front door open, the back door open, this happened, or the window's still open, or the door's still open, it's been open for a long time, or there's motion, someone just came into the room, or the front door is just unlocked. So yeah, being able to give clues to what's happening in their environment, to whatever sense or whatever certain aspect they're struggling with, and enable them to get as close to having that as they would otherwise with the tech and different devices we put in their house.
So Addison, let me ask you a question. You know, one of my concerns, I've had a few grandparents that had falls that contributed to major health declines. So we've talked about some of the devices, and we use this a lot with the families that we serve, of just, you know, there's Life Alert, there are watches and different things that are helpful. Some of that also comes with the compliance of the person using it and pushing the button. It's great that there's now some like automated fall detection systems, and we were talking about like it could just be built into the bathroom where there's common fall areas, or it can be built into a watch. One of the things that I was thinking about in the background, and you're talking about that situation, is could you build in with those motion sensors? You know, we're creatures of habit, and so when we know, you know, when our scenario is a little bit different. We've all heard of somebody that's had a fall and maybe a family member didn't check on them for a few days. I had a grandmother that had a fall, and my dad was a great caregiver for her and went out and visited her every morning, but she had a fall and spent the evening on the floor in her kitchen. She had a Life Alert but didn't hit the button. You know, if she had a device that would have detected that would have alerted right away. But if there were a way to build in those sensors, could you also program that to say, like, we know where someone would be, like they need to go to bed, they need to wake up kind of like within a time frame, and you're like, I'm not sensing motion, this is also a concern. Kind of have a backup in case.
Yeah.
Just from what do you think about that?
Yeah, so as far as getting a routine set that you're expected at certain points during the day, I've definitely set that up for people where, so in a bedroom, for example, you wouldn't want something like a camera because that's pretty invasive, or at least it'd be a last resort. But in a bedroom, you could have a motion sensor and you could have a sensor on the door. So for example, if they got out of bed, if there was motion for that, it would let you know, oh, hey, they started their morning routine. And then by 9 a.m., if the door hadn't opened, to be like, well, I haven't left their bedroom. And then if that got a few hours on, be like, well, I haven't left their bedroom. It's already lunchtime. Is there something wrong? So there could be not only redundancies that way, but less invasive ways to let you know what their daily routine is and if they're hitting those steps they need. And you can build those into whatever devices you want around the house, different areas you expect them to be in, whether that's outside or the garden or the kitchen or the living room, and have that routine down pat so you know if there's something a little off even before you get that text or that call that says there was a fall or something like that, because it might be something that's not necessarily an emergency, but it also might be a concern and you want to check into it, but you don't need to rush out to the house that very second, or it may be resolved with just a simple video call or a call just to check up on them and make sure everything's going well. So
yeah, that's good. You know, someone can really give you a call, someone that knows how to set those things up, and it can just run in the background. You don't have to know how
Yeah.
everything works, but you can just say, here's your problem, here's a solution, and just works on its own.
Yeah, yeah, and the beauty of it is you can change those. It's not all a once and done setup. You can change those based on shifting routines as things evolve over time. You can change those to give you more alerts or less alerts, or change the timing of them, and it's all done within a framework that's really easy to update based on the needs of their daily routine. So.
Mm-hmm. Well, and as individuals look at investing and the partnership and embracing, technology with maybe incorporating some sort of home care team or home care management, it's really a great opportunity, because you may need some help during the day or during the most challenging part of the day. But maybe with the partnership of technology, you might not need 24/7 care. And so you can really keep that investment to the point where you're aging in place safely. When we look at, making a move last year in 2019, an assisted living averages around 7,000. And then when we get into skilled nursing, you might see upper ranges of $10,000 a month. And so when we look at that return of an investment, when partnering with Simply Smart Homes or with you, Addison, it's just such a great complement. Nothing can replace human touch or having engagement or having a companion. But together, when we incorporate the safety and security of providing technology through those hours where there's not somebody else there in person, it's a great opportunity and provides, again, that extra level of a lifelong plan.
Yeah, and the added peace of mind that comes with knowing that if something goes wrong, there's always someone that it can be on the other end of it that can see what's happened, respond to it quickly. Even if they're not there 24/7, they have a little window into what's going on in that household, what's happening, and has an ear out for it. So you know that they're always there. They can always respond, and it doesn't necessarily have to be someone that's there 24/7. But yeah, they have that line of communication that's always open.
So Addison, as far as costs, it sounds like most of the time the investment for a very robust program put together is less than 1 month of what it would cost to move to assisted living. So it doesn't take very long to get a return on that, it sounds like. Is that right?
Yeah, I mean, a lot of times the price range varies, especially for individuals with different needs. But yeah, most of the time the overall upfront one-time cost is going to be, I mean, less, if not the same amount of just a single month of care like that. So the investment pays for itself within months. I mean, I haven't had a situation where I've set something up and it hasn't, in that context, paid for itself in at least a few months, if not less.
Mm-hmm. Well, that's good to know. Sometimes you might think that it's a lot more expensive than it is, but you're able to do that in a relatively affordable way.
Yeah, and technology has enabled us to more actively help people in situations like this in a way that wasn't really possible 10, 15 years ago, at least for the prices we're talking about or the levels that we want. And we hope that is the same for us when we're older and our kids are taking care of us. So yeah, it really does enable a lot, especially nowadays.
So I think, right now, while we're in quarantine lockdown times, we're connecting with our families in a lot different ways. So my grandmother, when I spoke with them on Mother's Day, hasn't been a user of technology at all in the past, never had a smartphone, doesn't do video calls. And so people are more open to that than ever before that I've seen that haven't embraced it in the past. And so that might be a positive thing, I guess, is that she's finding, I can do video calls, and just the start of getting used to using some of those things. It's not a very big learning curve, but you just have to start if you're not used to it. But it's also great that most people are very used to engaging with that stuff. So it's just easy to use as they continue to age.
Yeah, no, it's great. I mean, especially during this time, being able to video chat family and friends, keep up to date, especially when you can't hang out, you can't do certain things. So yeah, my own grandma, I've been trying to call her and video chat when we can for what we can. But it's really nice, especially FaceTime. You know, even if they don't know how to use Skype, all you got to do is call their phone number with FaceTime, and all they have to do is pick up. So it's never been easier to be able to connect like that, and hopefully more people will get into it and realize how easy and rewarding it is to catch up and actually have face-to-face time, even if you can't physically be in the same room.
Awesome. Well, Addison, we so appreciate your innovation and your partnerships to help keep seniors, anybody in the community, but to support seniors to have improved security and their families to have this peace of mind, so they're not up at night worrying. So thank you so much for all that you do. And what's the best way for people to reach out to you if they would like more information?
Yeah, so if people want to learn more, they can email me at addison@simplysmarthomesne.com. You can also call our phone number at 402-617-9928 and talk to us about our different options. We have free consultations. We can look at your household and see what works best for you and arrange a time to give you the best estimate possible. And then for more on our services and products, you can visit Simply Smart Homes NE, and the NE's for Nebraska, .com, and find out more about what we do. But yeah, I just want to say thank you guys for having me, and it's been a lot of fun. And yeah, I look forward to working more together in the future here.
Thanks so much, Addison. Have a great day.
Yeah, you too.